the audience will be joining us. Yeah, okay. We are live.
We're
Hi,
live.
everybody. I am Mark Wallace, and right over here, this is Kenna Klosterman, and we are doing our very, very first live Zoom quarantine multi-international session.
Via YouTube.
Via YouTube / Zoom. And so,
live.
Yeah. Okay. I'm looking now, and yeah, we are actually live. Yay, it's all working. I'm so excited.
Whoa, yeah, okay. I'm now.
We're live. Everybody. You're now hearing me through your.
Okay. I got to turn my volume off.
You just have to close YouTube if you're watching YouTube. It's like when you call into the radio station, you got to turn off the radio.
I know, but I wanted to see the comments coming through along with you.
Well, you can mute the video on YouTube.
That's exactly what I had not done. Okay. All right.
Yeah, I had that exact same thing when I was with Seth doing Coffee with Creators. I'm like, oh no.
No matter how many times we live stream, we still.
No matter how many times. And I think you have live streamed more than most people on planet Earth at this point. So I'm not sure how many times. So I know people are watching out there. What we're doing is we are going to have a sort of an honest conversation about travels around the world and our observations and how what we've seen affects our interpretation of the response to the pandemic. And so Kenna, this way, yeah, it's backwards. Kenna has traveled around the world. She took a 1-year trip around the world with Susan Roderick, is that right? And then then, you have done many trips. And so Kenna is a host of trips on many different places, retreats around the world, in Cuba, photo tours in Cuba. You probably recognize her from Creative Live. I met Kenna when she was doing Behind the Live 9 years ago. I think it was 9 years ago.
That sounds about right. That sounds about right.
Crazy, yeah. So I was doing my very first Creative Live and you were volunteering, is that correct? Is that what's going on back then?
Yep, Susan Roderick, another host of Creative Live, and best friend. She and I were volunteering for 1.5 years. And that was, it started 10 years ago. So it's really been an incredible decade. And I'm very fortunate and honored to continue to be part of Creative Live and bringing education to people all over the world. So.
Well, Kenna, I wanted to talk to you and bring this live to everybody because we actually have had many conversations. So you're one of my closest friends. And we've been talking about sort of the balance between doing travel photos and I'll just rewind our conversation and tell everybody
why we're here.
Why we're here. So since the pandemic has started, my travels through South America and Africa and in different parts of the world, but specifically in the developing countries, I've seen a lot of poverty and many refugees, and I've seen a lot of refugees from Venezuela and South America. I've spoken to many displaced people, but I've avoided talking about those things and showing any photos on social media because there's this sort of this impression for good reason that when you do that, it's a sensational, you're just sensationalizing your photography to get views, to get clicks, to play on people's emotions. And, some people refer to that as poverty porn, where you're just showing people these really poor people, not for their benefit, but for your own benefit. And so I have avoided taking photos of those situations, and I've really avoided talking about it or showing those things. But I was talking to you a couple of weeks ago, and I was sort of in this dilemma, which was now is the time that I think people need to know about the situation in the developing world because the pandemic is hitting people disproportionately, specifically because there aren't the resources that are in other places for these people specifically. And the reason for that is a number of reasons. Some countries, they don't have the resources, or geographically, it's very, very difficult to bring those resources to them. Or there are people that have fled social unrest or domestic violence or extreme poverty. And they did that to save their own lives, and they had to do that. And so now, because they didn't have time to go through all the proper channels and get all the proper paperwork, they're still trying to do that. They're undocumented. And their fear is if they do go and seek help, they could face deportation or imprisonment or all kinds of things. Sometimes that's true and sometimes it's not, but they don't have access to the information that they need to understand that. And so I was really struggling thinking, should I show some of the photos and tell some of the stories or not? And your response was, share them. That's what you want. And you've also had some of these experiences. So tell us a little bit about your experience and tell people where you've been around the world, because, you know, we're sort of starting from ground zero here.
Right. Well, thank you for having me on along with you for this important conversation. And one of the reasons that I wanted to join you, and again, we are trying to raise money for the International Rescue Committee, and we'll talk about that as well. But
Yes.
is that it is an important time to feel as though or not to feel as though, but to do something and to act. And so taking a step back, travel is sort of the thing that I've prioritized in my life. We all, you know, create choices and make priorities, and travel has been that thing for me for the past 25 years. And part of that is along with photography. Photography is a tool for me to get to know people when I travel. And I've been to 45 or 50 countries. That one you mentioned earlier, I traveled for the year of 2008 and went to about 20 something countries during that time. And you can't forget what you see. I mean, I guess you can, your brain does funny things. So let me say that. But when you come to understand something, learn something, know something, a lot of things you can't unsee or can't unknow. And so
let me ask you something really to sort of clarify, because what happened in Spain and Italy and in the United States, what happened in New York and New Jersey and Seattle, where you are right now, or close, I guess. And, you know, some of the more populated areas in the United States. And now we're seeing through all of the United States, what, 1.5 million cases or something like that, something close to that.
100,000 deaths. Yeah.
100,000 deaths. And so the question is, why should we be concerned with people in other places when we have these really pressing needs in our own countries? Why should we be concerned with other places?
Well, I mean, we're all connected, and it's very easy to say we're all in this together. And people can choose, and we encourage people to choose who to help if you're in a position to help, and it's not just one thing or one person. And so there's so many people that are affected, and yet we know, based on the research that's out there, the projections that places like the IRC are making, is that there's certain places in the world where it's going to be compounded so far because of the situations in the living situations and places where social distancing isn't possible. I mean, I saw something on YouTube or on Instagram today that from a photographer, Lindsay Adario, and she's doing a lot of coverage right now. And it was the front page of the New York Times that said 100,000 deaths, and it listed out names. There's a whole front page of the New York Times, just names. I hadn't seen that yet. And then somebody commented and said, you know, when that's not including the 130 million people, and I don't know what the numbers are, that will die from starvation, from suicide, from, you know, all the things that it's not just COVID-19 that will be killing people, and
Right.
all these other things. And so why help? If we can, then we should. I mean, you told me a story, uh, which was not a story, but as we had this first conversation about what you're doing right now, raising money for IRC, you said, imagine there were 200 families in your front yard, and they were sick, hungry, potentially going to die. Full stop. Like, what would you do? Would you help? And when you put it that way, like, okay, I know people are in other parts of the world, but if you can like visualize somebody in your front yard, then yes,
Right.
you feel obligated. But what's the difference if they're actually not there? Because they still need help.
Well, that's very true. And I think the other reason that's very important for us to try to help outside of our country, most of the people that are watching this are watching from the United States or Europe or a developed nation. And the difference between us and the people in those areas and someone who is a refugee or someone who's displaced or someone in a developing nation is that our governments have the resources and our local communities have the resources to help most people in the United States and in Europe and in developed countries. Whereas in Latin America and Africa, parts of Asia, they just don't. They don't, because of the geography and because of the situation of the people. They might not even know about those people. And so I think that's the big difference, is that to support those people in those places, we need to support nonprofits like the International Rescue Committee, the International Red Cross, those types of people. And so I've focused on the International Rescue Committee and have tried to fundraise for them specifically because of their approach to helping people. And they focus on women and girls primarily, and refugees and the displaced. They're in 26 cities in the United States. Mm-hmm. So they're in the United States helping to settle refugees. And so they don't just go in and help for a week or two. They go in and help so there's long-term security, and to help educate, to help provide healthcare, education, and when possible, to help people settle in the United States. For those people who are welcomed by the United States, they help them, and not just to get there and do the legal paperwork, but over time. And so it's a long-term commitment, and they work with local people, indigenous people. And so it's not the kind of thing where you have a volunteer flying down somewhere for 2 weeks, having a great experience and going home and showing a slideshow to a bunch of people. These are organizations that are working with locals for years and years. And so that's why I think the International Rescue Committee is very important. But I know you've been to many, many places. And so can you show us some of your photos? One of the things that is difficult for people who are impoverished is the informal markets. And so if you have some photos of that, I'd like to talk a little bit about what those are and why this pandemic has sort of hit us with a 1-2 punch by closing those down.
Sure. So when I prepared some images, just as you mentioned that this might be something we want to do, and I do want to say, I mean, it's all very complicated and nothing is black and white. And as photographers traveling, like you said, photographing people, whether you are having conversations with them or not, how you present that work, who's it for? I mean, none of this is straightforward. And so to your point about what you share or don't share, for me, I love traveling because I love learning about new cultures. And so a lot of the way that I create images is often sort of a documentary style. So I'm not necessarily, making judgment on something, but just documenting what I'm showing, like you said, witnessing.
Yes.
So let me see about the share screen scenario. Share screen.
Share screen is going to work.
Lightroom Classic.
We had a technical glitch right before we started, so that's why we're a little nervous. Okay, here we go.
Is that sharing?
That is definitely sharing. Yes, I see it.
Okay. So one of the places that I love to travel to is Cuba, and I lead tours there, and both photography and otherwise. And I fell in love with Cuba. I've been there about 12 times. Let me move my mouse. And so whether it's, somewhere like this where, oh, did you just lose me? No. Okay, never mind.
No, nope, you're still there.
Okay, I'm watching the delay. That's what was happening.
Yeah.
Okay. So I don't know. Do you want to talk about the informal marketplaces? What
sure.
you said? Yeah.
I can talk about it. So the thing with the informal marketplaces is that a lot of individuals in not just low income, we're talking about poverty. There are individuals, millions, tens of millions of people. I think the estimate is like 20 to 30 million people that are doing this just in Latin America. That the way that they bridge the gap between being able to feed themselves and their families and not is through these informal markets. And so they go and they're in every single tourist town and place. There are people selling candy and lollipops and things like that, but also they're selling things like this. This is, I guess, this is petrol. Is that what or gasoline?
Yes.
Yeah. So they're selling.
So this would be more the local market.
Yeah. Right. So it's both things. So it's people selling to locals and people selling to tourists. And these are in markets throughout countries all over the world. And so they're out in the streets, they're out and about. And so what happens is when the quarantines come in, that all of those markets are closed. And so it's a double whammy because then the individuals have to return to very, very tight quarters. And so they're in houses and apartments that are very, very packed with usually families or several families in an area that has limited access to hygiene. So running water and proper sewage and cleaning. And so they don't have hand washing stations and stuff like that. And so they're at higher risk of contracting an infection. But other than that, they can't make a living, so they can't feed themselves. And so they're hit with poverty and being at risk. And so what happens is a lot of these people have no choice but to break the quarantine and go back out and try to sell things. But it's not just selling things. This is also the way people get their daily food and provisions and stuff. And so what's happened in Latin America is in many countries, in Chile and Peru and in Ecuador, and in some cases, Colombia, and in large parts in Brazil, there have been these spikes of infections, and it is disproportionately affecting those who have no resources because they don't really have a choice of staying at home and having a fully stocked fridge and being on furlough for a week or two or a month or 2 months and having some kind of an unemployment check or maybe a family or something that's helping them. These are people that are doing the opposite. They left where they live to send money back home to try to support families. So not only is it affecting them, it's affecting the people that they're trying to support. And so it's this snowball effect of the poverty gets worse, the infections for COVID-19 and other sicknesses increase. And so there has been a migration of Venezuelans trying to make it back into Venezuela through South America. There have been people locked down. It's really, really a bad thing. And in Brazil, there's sort of a different story happening because the government reacted differently in Brazil than they did in other parts. And so we're seeing Brazil is now number 2 in the world for most infections. And they're just starting their curve up. It's really, really, really bad. And so I am talking to a few Brazilian artists to try to come and tell the story from that perspective. So we're going to hold off on telling sort of what's happening in Brazil right now. But the need is really, really high. And so what you can do as a photographer, there's a few things. So before we talk a little bit more about the photography and the art and what painters and writers and artists can do, I want to encourage you, if you are watching and you're feeling like, hey, what can I do? there is a link in the description of this video to the International Rescue Committee. And so I'm raising funds to help the International Rescue Committee get into these places to provide food and medical care and education and care. And so if you can donate $1, $5, $200 or $1,000 or more, please do that. And so, by the way, I should have said this at the very beginning of this video, but this video is being monetized. So you might see some ads or something playing. And so because of the status of my account, I can't create a fundraiser. So instead, what I'm doing is I'm monetizing this video, and any money that comes from that is going also to the International Rescue Committee. So if you've seen an ad, that money is going. So I should have said that right at the beginning.
Thank you for clarifying that. Yeah, I didn't even realize that.
Yeah, I forgot. So I forgot to write it down. So that's happening. Okay, so just before I forget, we do have some people online. So I want to say hi to a couple of people here. So we have Jots. So Jots Design says hi. Jose is from Puerto Rico. So he's here. Luigi is from Venezuela. So maybe Luigi, if you're still on, you can, in the comments, give us a little heads up of what's happening here. And then we have some other people here, but I just wanted to make a shout out from them. If you are watching and if you have a question, throw it into the chat. We are looking at that, so we will be able to do that. I also, if you don't mind, I have some images to share. Is that cool, Kenna?
That's fabulous. I realized as I was flipping through mine that that I was the one in control of whether of the share screen. I was like, oh, I could have stopped sharing those.
Nope, it's all you. You're in charge. Yeah. So I wanted to show a couple of things to sort of help if you've not been to these places, to help understand. This is Quito, Ecuador. And you can see this is in a normal middle class, upper middle class neighborhood. And so you can see these are big apartments, but they're right on top of each other. If we go forward in this again is a normal middle class neighborhood here.
Mark, sorry, I'm just seeing a white screen.
Yeah, what is going on with the white screen? That's what I'm seeing on live as well. Let me see if I can bring it back. How about now? Let's see. I hope this works. All right, I'm going to unshare and reshare to see. Did you ever see any images?
No.
Or was it only white screen?
Just the white screen.
Just
As
the white
I always
screen.
say, this is the beauty of live.
This is the beauty of live.
As you troubleshoot that.
All right, how about that? Let's see.
I see white.
Still white. Well, that's a bummer because
switch to a different image, maybe.
Perhaps. I have the world's not the oldest laptop, but a very old laptop. All right. Well, we'll keep talking. But the point that I wanted to make was that in many of these places, that the housing is very congested, and so you can have in the space of a city block, you can have maybe 5,000 people or more. And so like I'm in a little Airbnb apartment here. It's just me, but just down the street, about a mile from here, is Villa 31. And it is one of the most congested places in Buenos Aires where I am. And so in this same area that I'm in, you might have 15 or 20 people. And so the standard that we know is let's social distance and wear masks, wash our hands, disinfect, clean. None of those are options for these people that are being disproportionately affected. They can't social distance. They can't wash their hands because they don't have running water. They can't disinfect because they don't have access to the alcohol and things. And so fortunately, in these areas, specifically in Colombia, the International Rescue Committee is getting to those places and helping them and helping Venezuelans get back, helping provide healthcare for women in Colombia, which is just an amazing thing. And then there are other organizations that are going into these places. In Brazil, it's the favelas. In Argentina and Chile, it's the villas. And so we would call them ghettos or slums. they're all the same thing. It's just a place where poverty rules the day and there's not access to the normal amenities that we have. This is why we need to help out. So I'm going to close my Lightroom and see if I can reopen it.
Okay.
And I don't know why it didn't share.
In the meantime, I mean, you mentioned again, so I'll mention again, if you're watching this live, we would love to hear from you what you're observing, what you're seeing in your communities, Luigi in Venezuela. There's Fernando is there in Buenos Aires as well.
Oh, Fernando's in Buenos Aires. I wonder if that's Fetty.
Fernando Dip, is that Fetty?
I don't think it's Fetty, but anyway, yeah. Fantastic. Fernando Dip, maybe we'll meet. We'll go have a coffee. That'd be fantastic.
From a distance.
From a distance, yeah. Okay, well, I'm going to try to share one more time. Okay. We're going to see if this will work. I hope it does, because that's the whole point of doing this, is that we can share images.
There it is.
So you see it now? Okay.
Yes.
All right. So you have to open Lightroom after you launch Zoom. That's the thing. Okay. So I'll show you again. Now you can see that, I hope.
Yes.
This is the street I was telling you about in Quito. This is just a normal middle-class neighborhood. And here also, these are normal houses. So this is something that you can see that these are very tightly packed. This is the normal city in any country where we have people very, very close to each other. But as I go forward, this is the aerial view of Quito at night, just one of my favorite cities. It's a really wonderful city. This is a city that's different though. This is Guayaquil, Ecuador. And so you can see here, I don't know if this will show up zoomed in or not, but there's 1, 2, 3. This is 9 apartments in this one little building here. If I zoom around, you can see that this is a much more tightly congested place. So you've got people on top of people on top of people. And so what happened in Guayaquil is, in these neighborhoods, there were people that they just couldn't get to. They couldn't get to these people to help them out. This is in northern Peru, this image right here. This is one of those informal markets that we've been talking about. But in Guayaquil specifically, there were people that were getting sick. They didn't have the resources, the medical resources, to go and check all of these people. They didn't have testing. And thousands of people died, and hundreds of them were left inside their residence, where they just couldn't get out, or they couldn't find them. They didn't know they were there, and they didn't have anybody to go get them. And then when they finally did get these people out, they didn't have any place to store them. And so there were bodies in the streets of Guayaquil, in caskets and in bags. And it was one of the worst places hit, one of the places that was hit the worst in South America. And it's an indicator. It's sort of predictive of what's going to be happening in the villas and in the favelas in Brazil and in Chile and in Peru and all over Latin America. And even it could be worse in Africa because of all of these different things. So you have poverty, you have tightly knit families in really close space, a lack of hygiene, and no resources to meet that. And so that's the difference between what's happening in the United States and in Europe and what's happening south of the equator. It's much, much different.
Yeah, I mean, I have been looking at the IRC's website, which is just rescue.org, which again, if you're just joining us, Mark has started a GoFundMe that the raises money directly for IRC. But it just, like, you scroll down and you look at some of the statistics, and that's where I feel like when you hear numbers, when you can, like the numbers you just talked about in Guayaquil, it's like, what brings it home to you? And maybe that's different for different people.
Yeah.
But there's, I mean, I'm just reading from their site right now. There are 11 ventilators. 11 ventilators are available for Burkina Faso in Africa's population of 20.9 million people.
20.9 million people.
11 ventilators.
And so what's the population of Seattle?
Greater Seattle is 2 million people.
2 million. Phoenix is 4 million, 5 million, around there. New York is 16 million-ish. Yeah, so just think New York plus Seattle plus Phoenix, put them all together, 11 ventilators.
LA, yeah.
Yeah, or all of LA.
I mean,
11.
This says that half of Venezuela's doctors have left the country because of the humanitarian crisis. Do you have more?
Well, I think it's higher than that. I believe that the number is about 90%.
Oh.
Of the doctors have left Venezuela. So it's difficult to get those numbers, but those numbers come from I believe I was reading that from the World Health Organization, or it might've been some of the papers down here, the BA Times, Buenos Aires Times. That's where I got those numbers. But I also know this because when I was in Santiago, Chile, a fantastic city, I met several people that were refugees from Venezuela. And two of them, we went out and had dinner and had a long conversation, and they were both doctors, and they had left Venezuela, and they were telling me the stories of how many people have had their training, they're ready to go, but it's just not tenable to work in Venezuela. And so in Venezuela, the reason we have such a refugee crisis is because of the social unrest and the extreme poverty and the outbreak there. The issue is they might have a hospital bed, but they don't have anybody that can, it's not just they don't have a ventilator, they don't have a doctor or a nurse practitioner or a PA, nothing. Yeah. And so, I was talking to Alex. So we had another one of these sessions, but we did it on Instagram. And so my friend Alex, he is a migrant. He left Venezuela and went to Panama City, and he was talking about 6 years ago is when he left because of the violence. And when he goes back, so he was back a few months ago, he said that the mentality of the people has shifted, and it's solely focused on survival. And so it's it's how can I get the bread before somebody else does? How can I get the food? The black market is, ramping up prices exorbitantly. Mm-hmm. There is no fuel. There is no, you have to stand in line for all day to get resources. And so the need is really, really great. Now the IRC cannot get into Venezuela at this point. Mm-hmm. And most health, organizations are having a difficulty getting into Venezuela. So they have to treat refugees and people on the borders of Colombia and in Ecuador and in Brazil. And so it's difficult. I know there are organizations, a lot of organizations in Venezuela, but Caracas, which is where the most of that need is, it is the most dangerous city in the world. And so it's not somewhere, it's like being in a war zone. It is being in a war zone. So that's why the need is so great. Anyway, I want to remind everybody, if you're watching this and you feel the need to contribute, and this is something that resonates with you, please go to the link on the description of this page, go to the fundraiser for the International Rescue Committee and make a donation. If it's something you want to check out and learn more about, just go to rescue.org and you can read all about that. There might be a local organization that you want to get involved with. The challenge really is, as artists, we have this ability and a gift where we can take photos, write stories, make videos, paint paintings, do all kinds of things that allow us to amplify the voices of those who are in need. And so they have things to say and they have needs, and they're trying to connect with people. The difference is if you're a refugee or a displaced worker and you're in Colombia or Chile or somewhere, you can speak and ask and tell your truth, but there isn't an audience. And so what we can do is we can listen to those people and document what they have to say, and then broadcast that through our social media, through our web pages, through our organizations, and help to amplify the voice of those people that need help. And so that's really what we're asking you to do. Either help us by amplifying, or if you've heard, give. It's that simple.
And I want to continue that conversation, Mark, around, I mean, again, what I was talking about earlier is like, what is it that clicks in different people to sort of hit home or motivate you to act? And for me, it's often these stories of individual people that represent sort of a bigger issue. I'm hugely drawn to the work of photojournalists, of documentary photographers. I have a podcast out there that is called We Are Photographers. That's for Creative Live, where I talk to photographers and filmmakers, and it's really is about their journeys, the wins, the losses, and what connects us all as humans. And I've had a number of photojournalists who have worked with refugees, have worked in and seen sort of some of the world's worst atrocities with their own eyes, and that those individual stories, I think, are what can allow people to connect with somebody just as another individual. Like that culturally there's all these differences all over the world, but the only difference between me and this other person might be where I was born, when, and kind of circumstantial. Like, we're all human beings having a human experience.
So on now, so Federico, their only portrait. So I'm not sure if this is the same guy that I know. So there is a person, I think this is the same person. So Federico, if this is you, tell me. There's a guy that I know through social media. We haven't met in person, but he is traveling by bicycle through South America and taking photos of families and individuals and giving them portraits. I think this is the same person.
Well, he says he just returned delivering solar lamps and printed portraits.
Yeah, and so Federico, post your social, your links and stuff in the comments so people can sort of see that, because it's really sort of an incredible thing. And he's doing what you're talking about, Kenna, where he's able to show people all these different things. I do want to show a couple other images here to help you connect with sort of what's happening. This is a tourist town. It's called Runabaki, and it's in Bolivia. Maybe you've been there. I don't know.
I have not.
But it is a very common place that people go to enter into the Bolivian side of the Amazon jungle. And the way this, I don't have great pictures of this little town. I only have one from my little hotel rooftop. And but the thing is, you have to fly into this place with a really crazy remote jet. There are no roads to get to this town. So you have to fly in with this small plane to get there, or take a boat. So what I did is I flew in on this tiny little jet and got here. And then I wanted to get into the Amazon. And so I went by boat. So this is me, and I think there were 10 other backpacker adventure people. And we went, this is the river. So as we flew out, I took pictures of the river. And these rivers are the roads in most of the Amazon rainforest in the remote areas of South America. So there are many cities in northern Peru. And so if you look at the northeastern part of Peru on Google Earth or Google Maps, you'll see all these little towns. But if you look closer, there's no roads going to those towns. The way people get there is either by small plane, like the Bush planes in Alaska, or by boat, and they go down these rivers here. And so this is a common sight in the communities like this, is you have these little boats that are parked along the shoreline, and this is the highway. This is, I-5. This is the way people get around. It makes for fantastic photos. So this, I took this photo because I thought it looked so amazing, but it also is a stark reminder of how difficult it is if there's an outbreak in these communities. If there's one tourist that goes there, or one person that comes from an outside place who accidentally brings the coronavirus and infects people there, to get them supplies is not as simple as sending in an ambulance. There is no way to get there other than by taking a treacherous journey or sending in very expensive flights. And this is similar to what's happening all over the interior of Brazil now, where, we're thinking from our American perspective or European perspective, why is this so difficult? Why don't you just get the medicine to these people, take the ventilators, get the doctors there? But it's not that simple. You can't just zip in. You have to do some pretty treacherous things to get there. So again, if you're watching this and this is something that you're able to do, please give freely of your finances to help the doctors and the caretakers and the people that are helping these people, because the need is great. It really is.
So Mark, that is your friend, Federico.
Okay.
His Instagram is @their_only_portrait. And he, as you probably know, it was in February that he went there to deliver portraits and got stranded because of COVID-19 and was just able to get home last week.
Just got out of Venezuela.
Yeah.
Okay. Well, Federico, maybe we can have a chat. I'll send you a note later. So I was not aware that that's where you were. All right, Kenna, I know you have some other pictures to show us. So help tell some stories and show us some more stuff. I know I just put you on the spot.
Well, I already flipped through the images. I didn't tell any stories per se, but so maybe we can go back to that. Let me share my screen back over here. Share screen.
And I'm going to check while you're doing that. I'm looking at okay, great. Yeah, I'm looking at the comments and stuff to sort of see what's going on.
This is what happens when you have two hosts, is I'm like, we're both.
I know, we're both hosts.
So in terms of sharing some stories, again, about connecting with individual people, it's one thing to do sort of some street photography from a distance where you're documenting places. And then it's another thing for me to actually have meaningful, quote unquote, have interactions with people where you're getting to know a little bit about them, and then supporting them directly. So these women I was in Kenya and was a informal marketplace. And, people are so beautiful in general, and spirits. And so, like Federico was saying, like I wasn't delivering instant prints to them, although that's not true. I carry around a little instant camera and do share that with people too. But, these are women who rely on not just tourists, but other people who have money to shop in their stores or in their stalls. And so, just having those connections with the people who you purchase from. I'm actually, when we go back to me, I'm wearing earrings that I purchased from these women. And this particular woman that I'm showing on the screen right now, when I first asked to take her portrait, she said, no, like, I've got a triple chin, I've like all these things why I couldn't take her portrait. And I was like, no, you're beautiful. Like, look at your eyes, look at your smile. And I took the picture and then showed it to her, and she just lit up, and so it's that I'm kind of going all over the place here, but this photography allows, and photographing people in their environment, people who don't necessarily have access to images of themselves, is just something that I think is a beautiful thing that we can do as photographers. And I did not pull up my notes today about their names and
okay.
They're full of stories, but I am wearing their earrings.
And the important thing is that, to help people understand the difference in the need between South America, Africa, Asia, and the United States. It's a big difference. I have a couple more pictures that I want to show just really fast, because the question is, why do people end up in these situations? And I grew up in this mindset or a community where many people attributed the cause to the person themselves. And so the poverty was visited on someone because they were lazy, or they didn't work hard enough, or they didn't take the initiative, or they didn't get their education, or they were a drug addict or a thief. I mean, the list goes on and on and on and on. But really, that is not the case for the vast majority of immigrants and refugees. And so there are several things that happen, and I've been witness to the results of some of these things, and some of them that are happening in real time. One of the things that is nobody's fault as a victim is war, of course. And so I visited the Genocide Museum in Cambodia. So this happened in my lifetime, and I was really fascinated because a lot of, when I grew up, we heard about the Holocaust and World War II and never again. And it was later in life, so in my late 20s, that I learned about the Khmer Rouge and the genocide that happened in Cambodia in my lifetime. So this happened when I was 7 years old. So, I was a child, but my parents weren't, and, their friends were not. I had no idea this even happened. And so when I started researching, these are all victims of the killing fields outside of Phnom Penh. So there are many, many of these. So millions of people died in this genocide. So this happened in 1975. And so this is a memorial to one of the killing fields. And so these are all skulls of those who died. And this is where they're housed. This is a monument. And so there's this tower there that houses those. But the thing with genocide and war is it's easy to remember what happened in World War II and the Holocaust and think, thank God that's over. But it's terrifying to learn that it happened again in Cambodia with Khmer Rouge. And it happened again in Sudan. It's happened in Africa, the DRC. And these are all in our lifetime, Kenna. This is you and me. This happened in our lifetime.
It's right now. I mean, in Myanmar.
It's right now in Myanmar.
1 million people, who had to flee.
Yes.
And the outbreaks in those, there have just been reported in the last couple of weeks, outbreaks in the Rohingya camps, which again, 1 million people who had to flee, and not by choice of wanting to find a better life in some other place.
No, they were
but
being
because
killed.
It was the only option to not be murdered.
And this is happening today, right now, this
Today.
very hour. This is not something that happened in history. It's happening right now. And I don't know, also, if you're aware, with the weather over there. So there was just a big cyclone. And so not only have they been hit with genocide and now COVID-19, but now flooding. And so those are the types of people that need our help. And the International Rescue Committee is helping those people. They did not choose by laziness or lack of education or any other reason to do that. It was violence that was visited upon them for no good reason.
And I think that's the important point to make, Mark, is, and thank you for bringing that up, because a lot of people have misconceptions about circumstances that refugees might be in or have, and you're literally saving the life of yourself and your children. And, and it's kind of that when you talk to somebody who's been in that situation, it's like you can realize you would do the same.
Right.
And again, going back around to, if you are, I feel I am a very privileged person, and where I was born, when I was born, place, my family, all of that. And I recently was listening to a speaker talk about privilege, and a lot of people don't want to talk about that or feel, it's like, but she said something to the effect of, like, own that privilege and do something with it.
Sure.
Not own it, but like, so those people who are out there right now who are hearing this, and I heard you say this, Mark, and one of your others, like, you know who you are. If you can't help, that's complete from a financial standpoint for donating to IRC, like, wonderful, like, great. But if you know that you can, even small amounts, again, Mark has the GoFundMe that goes directly to the IRC. I appreciated, Mark, when you said on another broadcast, it's not your goal is $10,000, and it's not like you're waiting till, it's not like it waits until you hit 10,000 for the money to go to IRC. It goes directly. You're basically taking their GoFundMe and being a team of it, a branch of it, and that's going.
Yeah, it goes.
Directly.
And the other question I had from somebody else, I can't remember, they said, what's the time limit? When are you trying to get this? And I was trying to explain there is no time limit. And the only reason I put $10,000 is I had to put some number. You know, the goal is as much money as it takes. That's the goal. But I described it as, you know, if your house is on fire and everything that you love is inside that house and you're trying to get it down, you're trying to put it out, you need water. You know, you're trying to get enough water to put out the fire. You're not trying to get enough water to put out the fire in 30 days. You're trying to get as much water as you can right now, because the faster that you get it to the fire, the less damage occurs. And that's the same thing with the fundraiser. It's that we need to help the International Rescue Committee and other organizations with as much water as we can, as fast as we can. And the thing with the outbreak in Latin America and Africa, if you go to the International Rescue Committee website and the World Health Organization and some other places that are doing research, they are predicting that if there isn't an intervention quickly in a lot of these places, up to 20 million people could die. The conservative estimate is 3 million people, but that estimate assumes that all of the countries that are about to get hit in Africa and South America and in Latin America and in Asia, in Myanmar and those places, that they have the same standard of healthcare as China. And they don't. They just don't. They don't have the doctors. They don't have the hospital beds. They don't have the ventilators. They don't have the roads. They don't have the infrastructure. They just don't have that. And so if the standard was the same and the response was the same, and we could do something really quickly, then we could cut that off with just a few million people dying. But if things happen the way they are happening now, that number could climb into the tens of millions. And so, and it's not a theoretical thing. This is a real thing. And I always thought, what would I have done had I been living in the 30s and 40s during the time of the Holocaust, or in Cambodia during the time of the killing fields, or during the slave trade, or during these times of great need? What would I have done? And it turns out we are living in that time now. It just looks different. And so we're not looking at guns and violence necessarily. What we are looking at is a great need of poverty. Poverty is what we're at war with here. And we can fight poverty with education and healthcare and a number of things. So I want to talk to you about another thing that leads to this kind of a situation. And that is something that I've seen primarily in Latin America, but also to a great extent in India and Asia. And that is the disparity between the wealthy and the poor. So wealth distribution. So in the United States, anybody that's been paying attention to the news knows that the middle class is sort of shrinking, and there's been this separation of the distribution of wealth. Well, that's been happening for decades and decades in most of the world. And so you have this distribution of money that is, you'll have people in abject poverty literally camping next to a mansion. This is a common thing that you see all over India. You'll see people that are in abject poverty next to people that are in great privilege. And so in Latin America and in South America, we had the Arab Spring 10 years ago. There's the Latin Spring. I'm not sure what they're going to call it now, but because of what happened in Venezuela with some uprisings and things, and there's this inequity happening, that sort of spilled over. And so we're seeing that in Ecuador. There have been uprisings. The civil war in Colombia finally ended about, I think it was 4 years ago, 3 years ago, but there's still some issues that are going on there. But in Chile, which had been the most stable South American country as far as economics, there have been some serious issues. And so I was able to see firsthand, this was in February of this year. So late January, early February, I was in Santiago, Chile. So I saw these demonstrations in Iquique, in Santiago, and in other places throughout Chile. And what's happening is there are a number of demands that protesters are making. They want a new constitution or some amendments to the constitution. They want wages to change. There are a lot of different things. They're not going about it in the best way. But what's happening is before the outbreak, thousands of people were going into the city, smashing the sidewalks, taking the bricks and all the metal, all the things, and throwing those through shop windows and at police, and lighting subway stations on fire, and causing all kinds of issues to try to get the government to react and respond to this. And so there has been in Chile a national emergency for months. So I believe they declared a national emergency and curfews and stuff way back in October or November of 2019. And so this is about a month before the pandemic hit Chile. And so you can see that there are thousands of people out, and they're not wearing these masks because of the pandemic. The pandemic hadn't arrived yet at this point. They're wearing these because of the tear gas that the police were throwing into these crowds. They're going through the city, and artists in the city are painting and making posters. Photographers are plastering streets with images of the abuses by people in power. And so artists are really sort of spearheading people to come out and protest. And the crowds are gigantic, or they had been. So this is just in one day in Santiago. But these kind of protests have been happening in Argentina for women's rights, for women's healthcare. There's been some big protests here in Chile. There have been these protests in Colombia when I was there in December and January and November. There were protests throughout the country. And so there has been an uprising and a demand for some social change in all of Latin America before the pandemic hit. And because of all of these social uprisings and unrest, the economies in many countries have had issues, and the police forces and medical workers, they've already been under great strain because of what has been happening in Latin America. And so this kind of unrest can escalate and become something that's much, much worse, as we saw in Venezuela, or it can lead to real reform. And so right now, we'll see. But this is the kind of stuff that's been happening and is happening currently in Latin America in some places that has led to, again, a greater risk for those that are in this place. So again, I'm going to keep showing a couple more pictures, but the reasons why people leave their country and become a refugee or become displaced or lose everything they have is not because they're lazy or because they have, they haven't got their education or something. It's because of things that are outside of their control. All right, I think enough of those pictures. I'll stop there.
Well, I think that's a a really important thing to continue to hit home is, if you think about, again, just putting yourself in people's shoes, just get educated, as I'm doing now. I mean, I'm not educated on everything that is happening in every country, and so the more that you've talked with me, Mark, and kind of the more your eyes get open, the more that you we like to live in our little bubbles, because it's hard to see things that are challenging to us. And I think that's something that has struck, I can speak, stuck with me, of what you said Mark, is that it's time to get uncomfortable. And here's the thing, like, I mean, all of this has been going on all over the world over time. It's not new. It's just that the pandemic is amplifying things even more in these places. And so, maybe it's bringing awareness of situations that, people here in the US didn't have coverage necessarily of what the images that you just showed us. You would message me things, and on WhatsApp, and I'd be like, oh, I'm not seeing that here. And so it's just, it is our responsibility to educate ourselves and then, turn that around into what can we do?
It is. And we must do what we can to do good. And so my challenge is for those who can to donate to the International Rescue Committee. Or if that might not be something that resonates with you, but you still know that you need to get involved and use the things that you have at your disposal to help. And you can do that in a number of ways. You can be the voice of your local food pantry or the volunteers that are helping in your community. You can document what's going on with the teachers and the first responders in your own town. You can help do fundraisers or volunteer or give blood or do any number of things. But as artists, we can tell stories that support the work of others. And I think that's where we fit in. And so if you're in a community that has a specific need that you can address, you should do that. And if you have some ability to write, and maybe you can write some articles for your local newspaper or national newspaper or blog or be a guest on a show or whatever, whichever way you can, you should. If you're an illustrator, you can demonstrate what's happening around the world by creating some amazing graphics that simplifies things. If you're a painter, you can maybe paint something that helps people understand what it means to be alone. A lot of people are extremely lonely right now and feeling very, very isolated. And the thing is that we can help people understand they're not in this alone. They might be alone, but they're not the only one that's alone. And the other thing, Seth and I were talking on Coffee with Creators, there is a huge space for comedy and entertainment because it's needed right now. And so maybe you're an actor or you're a comedic writer or you're, somebody that can make funny TikTok videos or YouTube or whatever that is. And so I don't think that there's to necessarily say, hey, if you make funny videos on YouTube, that's any less of a help than people that are campaigning for, the rights of some group or something. The emotional health of people is very, very important. And so the point isn't go out and give us money so we can help the International Rescue Committee. Definitely, we want that to happen. But more so, we have to look at the need of the world over decades for our lifetime. That is always going to be there. And so I think that we have the great privilege as artists to tell stories and to make people laugh and to educate people and inform people. But I think more than that, we have the moral obligation that we have to do that. We've been given a great gift. And so there's an obligation that goes with that. And so in whichever way that works for you, you should do that. And I think that's the message I'd like people to take from this.
I thank you, Mark. I mean, I think that's we've talked a lot about, or, you know, donate money if you can, but truly we have stories, ways to tell stories, and it doesn't have to be with telling stories of refugees, like you said. Like it's even when you first talked to me about what you wanted to do, it's kind of like, well, how can I, you start to think about, well, what can I do? How can I help? Is it going to be enough? It doesn't make a difference. And I guess I just want to say, like, yes, whatever those little things, that not just little, but whatever it is that you're drawn to, Mark, like you said, like, what is it? Does it resonate with you? What resonates with you? And that's what will, you know, hopefully motivate you to do something. And so I guess it's, for me, Mark, I want to make sure that also, I mean, what are you hoping for anybody who's listening to this? Like, are you looking for more people to come on and have conversations with you? To
I am.
kind of create like a, you know, if you're out there doing some good work, like, let us talk about it, you know, or what are you looking for?
Certainly, the thing that I'd like to do, and so on my YouTube channel, where people are watching this, they're probably going, what the heck? Mark Wallace hasn't been on his own YouTube channel in years, but this doesn't really fit anywhere else. And so that's why I brought it back to my own YouTube channel. But if you're an artist, specifically if you're a photojournalist, or you're a portrait photographer, or you're a travel photographer, or you're a writer, somebody that has actually been in some of these locations that are in great need now, or you can tell the stories of people that have met the need, I'd like to talk to you, because I'm not really interested in showcasing your work and making a name for anybody. That's for myself included. I don't want to do that. Really, what I want to do is to magnify the voices of those who are in need, so that we can expand our worldview and look and find ways that we can be involved and help. So if you're an artist that can help others do that, then yeah, let's talk. And so I am going to be having other people in this same space, and some of them are just going to be fun tutorials. So we're going to have on some photographers, and we're going to show people, like, hey, we're going to do a live show showing you how to do fashion photography, or how to do some post-production or whatever. We're going to do tutorials, but those are going to be solid fundraisers. And so we're going to be giving away some packages to anybody that donates. We're just going to blatantly ask for money to help the International Rescue Committee. And in exchange, we're going to try to teach you some things about art. And then we're going to be having some photojournalists and some people that are in the thick of it. So I'm talking to a few photographers right now that are in Africa and in South America that are just in the thick of things. And so I'm going to have them come in and talk about sort of how they're dealing with it, how they're getting into the hospitals and the favelas and the villas and those types of things. And so we're going to have those people try to explain what's happening. So there's just a lot of places. But if you're watching, please, there's the link in the description of this video. Click that link and make a donation, or at least go check out rescue.org so you can see what they're doing. That's really good. Ken, I think we're out of time. Is there anything that you would like to say to wrap up?
Well, again, thank you for having me join you in this conversation. I think that one of the things that struck me as one of the photojournalists that I spoke with, who has done a lot of work with refugees, and was sort of like you were talking about, the moral obligation, like this battle between, am I, showcasing this person, is that not a negative thing, but am I taking that from them, and the comment about, I said something like, oh, well, you're giving the voice to the voiceless. And he said, they have voices. We just don't want to hear them. People just don't want to hear it. And that really struck home with me, in that I believe right now, to what you said, Mark, like, we have to get uncomfortable talking about uncomfortable subjects and hearing things that we don't want to hear. And I wish that, I don't wish for people to lose loved ones or know somebody who's lost a loved one, but I feel like often it takes somebody having a personal experience for them to act. And so, my hope is that people act before having to go through that.
Yeah, absolutely.
So thank you.
Thanks,
for having
Kenna.
me.
Thank you for being here. Again, if you're watching this, please check out the link in the description of this video. Go to rescue.org to find out more information about the International Rescue Committee so you can see the work they're doing and really to understand their philosophy, why they're focusing on women and girls and how they're providing healthcare and security and long-term help to those in need. So thank you for watching. Kenna, thanks for being my guest. It's sort of weird, me being the host for you. That's a reversal, but thank you for that. And so thanks for everybody who's been watching. And I think that will be it. So again, thanks everybody. I have to close this now. So I'm going to end the stream. Kenna, I don't know how fast this ends, so don't say anything derogatory. Thanks everybody. Bye-bye.
Thanks everyone.